everyone, welcome back to my channel. Nurse Katherine here. A few months back, you may remember that I made the transition from Pennsylvania down here to Atlanta, Georgia. And in that transition, I left bedside nursing. I was an ER nurse and now I work as an outpatient transplant nurse. Well, in today's video, I will be talking about going back to bedside. But before we get into that, because there's a lot that goes into that, don't forget to subscribe to my channel right now and give this video a big thumbs up. Other than that, let's get into it and let's talk some real nursing stuff right now. Let's reverse a little bit back to November and back to that one video that kind of blew up a little bit for my channel, which was awesome because it really got some raw emotion out there for other nurses, and that was why nurses are leaving bedside nursing. I talked a little bit about why nurses leave. I didn't really discuss in detail why I was leaving, but 3 reasons I left bedside nursing was the 12-hour shifts. The second reason, or a second reason, would be my work-life balance. I didn't have time to go to the gym on the days that I was working. I didn't have any extra anything, emotion, anything to give to my husband when I was coming home for the day and just talking. I was like, let me just eat a peanut butter and jelly sandwich and go to bed. Like, that's all I wanted to do. Or eat a bowl of cereal. Like, it was just not a healthy environment at all. Like, physically for my body, I wasn't eating right, so that was the reason I wanted to leave. And thirdly, another reason I wanted to leave bedside nursing was the toxic environment. Toxic from my patients, but also toxic from my coworkers. That environment can be grueling. It can be hard. It was just like, I just needed to get away from it. So those were 3 of the reasons, of many reasons, why I left bedside nursing. But today's video is talking about going back to bedside because, spoiler alert, I applied for a job on bedside nursing again. So let's get into it. Now, before I get any further, I am not leaving my job right now. I am still working as an outpatient transplant nurse. I love my job. It works really well with my schedule. I love that I can go to the gym before I go to work, or I can go to the gym after work. I still have time to cook dinner. I have time to eat well. It's wonderful. I'm not eating dinner at 8 p.m. at nighttime anymore. So it is really good. I am not leaving my job, so let's get that straight. But I did apply for a part-time position at an ER children's hospital, or the ER at a children's hospital down here in Atlanta. So I'm just waiting to hear back. If this is where God wants me, the door will be opened. If not, I always pray, okay, Lord, if this is not where you want me, please close the door and give me the patience and the wisdom to see if there's any other opportunities out there or what you have for me, Lord, because obviously He knows the future, I do not. So, with all of that being said, there were 3 major reasons I applied for this position to work as an ER nurse again. It has been a little bit of a rough transition, I will say, leaving bedside and going to the outpatient world. For the outpatient world, I will say I have a bit of a different job. It's more of an infusion center / clinic. I'm not triaging anybody. I'm not on the phone at all, really, at all, except to take critical lab results. So it's not like I'm doing telehealth, telemedicine kind of stuff. I'm actually doing infusions and doing clinics and doing the intake. So it's a little bit different there than other outpatient transplant or outpatient centers. So with that, I don't think it was as rough as a transition as it could be for some people, but it was rough. I missed number one reason would be the critical thinking. I did not realize how much critical thinking it took to be an ER nurse or a bedside nurse, any kind of nurse really, like at the bedside. So it was challenging because I felt like I was losing a skill going to the outpatient world, and I was like, oh, I'm not getting that critical thinking. I'm not really thinking about labs as much as I was before, and I definitely can see the loss of not wisdom or education, but when you don't use the skills, you lose your skills. Everybody knows that saying. So that's kind of what it felt like in the first couple months working, and I only started my job in March down here. So I even saw that within the first month. I'm like, what was that what's a normal creatinine again? Like, I couldn't even remember that because I wasn't seeing it every day, and it just wasn't there in my mind anymore. So that was one reason. I was like, I really wanted to keep those critical thinking skills. So that's one reason I applied for this position. I want to get back into that critical thinking and keeping that skill set. The second reason would be the skill set. In the outpatient center where I'm at now, I'm placing IVs still, I'm doing blood work, and I'm hanging infusions, but it's not a wide variety of infusions at all. It's like maybe 3 infusions, if that. So with ER nursing, you have a huge skill set. You have your CPR, of course, you are seeing emergencies, so you have those emergency patients coming in, you are doing CPR, all that good stuff. You are treating sepsis really fast, you are doing wound care, you are doing car accidents, broken bones, hip dislocations, shoulder dislocations, and popping them back into place. All that good stuff. Well, of course, I'm not getting that in the outpatient world, or I really don't want to get that in the outpatient world because I do not have the help to treat that in the outpatient world. So that is another reason I applied to go back to the ER. And thirdly, probably the most weighted reason I went back, or that I'm trying to go back to bedside part-time, not full-time, just part-time, is because I want to keep my skills in order to do medical missions in the future. A few of you may have seen my video in the past, my medical missions trip to Nigeria. If you have not, I do have a video on that, and I kind of did like a journaling throughout the trip type of video. So yeah, just to keep those skills and to be marketable, more so to go on more trips and just to help more, because right now what I'm doing in outpatient transplant doesn't really relate to the medical missions field for medical wise. Not sharing the gospel, that is always trying to learn that every single day and grow deeper in God. And of course, medical missions is putting the medical together and the mission of sharing the gospel together. Those are the type of medical missions I like to be involved in. So the gospel part is there, but then the mission side, I'm not keeping those skill sets that I used to have, and I feel like I'm losing them and I won't be as useful on these medical missions that I would, Lord willing, like to go to in the future, meaning that I'm not as useful in my medical side. So that would be the third reason I applied to go back to the bedside. I know the transition, like I said, is very hard for a lot of people if they left the bedside. So I am very curious, if you have left bedside nursing, what was the hardest transition for you? Those 3 reasons definitely were the hardest transition for me, and thinking about my future as a nurse and where I feel like the Lord is leading me for the future in nursing. But definitely comment below what was the hardest thing for you when you left bedside nursing, or if you're thinking about bedside nursing or thinking about leaving bedside nursing and what you may be scared of, or whatever your thoughts are about outpatient versus bedside nursing. Comment that below. I'm very, very interested to hear what you have to say. and whether you are happy with the decision or not happy with your decisions. So yeah, comment that below. But honestly, that is it for today's video. This was just kind of like a spill it all out there kind of thinking through video. Again, thank you for watching. Thank you for tuning in. Make sure to comment below and make sure you are subscribed and like this video. Other than that, that's it. So I will see you guys in Tuesday's educational video. If there are any topics you want me to touch on, you can also comment that below or just email me at nursekatherinehere@gmail.com. All right, that's it. See you guys later. Have a great weekend.